Intensive care for sufferers of COVID-19 is expensive. In Germany, patients on ventilators can cost tens of thousands of euros. Younger people are filling up ICUs. Their chances of survival are higher than the elderly, but they spend more time on wards, pushing up the price of treatment, which everyone pays through insurance contributions. Singapore is taking a different approach. It says those who don't get vaccinated have no right to pass the costs on to others.
Welcome, Ben Faouzin here. Singapore is experiencing its worst wave since the start of the pandemic. Around 90% of Singaporeans are fully vaccinated, though, but that number has to get even higher to reduce the strain on the healthcare system. That's why it's making life potentially more expensive for the unvaccinated.
In Singapore, getting a jab is not just going to save lives. Soon, it could also save people money. Until now, the government has covered the medical costs for most COVID patients. But starting December the 8th, anyone unvaccinated by choice will have to pay their own bills.
Our hospitals really much prefer not to have to bill these patients at all. But we have to send this important signal to urge everyone to get vaccinated if you are eligible.
Health officials say it's the unvaccinated who make up a sizable majority of COVID intensive care patients. The country is experiencing its worst wave of the pandemic as it moves its strategy from zero COVID to coexisting with the virus.
We will need to have safe management measures which differentiate between the vaccinated and unvaccinated. This is in order to protect the unvaccinated and also to preserve our healthcare capacity.
Prior to the planned hospital charges, the government had already introduced restrictions for unvaccinated individuals, preventing them from dining indoors, going to shopping malls or visiting attractions. For anyone still considering whether to get a jab or not, the high cost of an infection just might make the difference.
Well, Dale Fisher is an infectious diseases specialist and senior consultant at the National Hospital of Singapore. He joins us from Geneva. Good to have you on the show today. Can you give us an idea of the costs that an ICU patient could actually be billed with in Singapore if they broke the rules and ended up in hospital with a severe case of COVID-19?
So I think firstly, to put this in perspective, you have to bear in mind that currently in ICUs and in hospital, about 2/3 of the patients that are there, either on oxygen or in ICU, are actually the unvaccinated. And the unvaccinated, there's only 6% of the eligible population is unvaccinated. So the unvaccinated people really are taking the lion's share of health services. The death rate is much higher. So if you really want to talk about costs, talk about the cost of lives. And this latest measure is one in a string of measures and efforts to try and get particularly the elderly and the vulnerable, who have been actually our most reluctant, to get those people vaccinated. And as your report said, if threatening a fee or withdrawal of subsidy might get a few more over the line, then we're talking about saving lives, actually, not collecting money. Obviously, intensive cares are very expensive, and with Singapore's universal healthcare system, it's generally or virtually fully subsidised. So this is about saying you've still got time to get your jabs, but by December 8, there's a high chance you'll still get healthcare, but then there's going to be a debate about who pays for it. There are safety nets for people that genuinely can't afford it, but hopefully this is something we never have to do, and it's just maybe the last-ditch effort to get more people vaccinated.
So this is basically a warning shot. Is it something that's implementable, though, do you think, in your opinion? Is it feasible if there suddenly are many patients who are unvaccinated and end up in this situation?
So you really have to understand the funding of healthcare in Singapore. Everyone's got a MediSave account, which is a personalised saving, if you like, which has got contributions through your wages. So everyone has some thousands of dollars in their virtual account anyway. And certainly if that would be an easy way to apply this, is to take those funds. There's also potential to take that virtual money from other first-degree relatives and things like that. So this is how it works. If all those monies are used up, then yes, it could come down to cash. But following that, if there's no cash, then there's safety nets, and the government would still come in. People won't get refused treatment.
Dale, can I just butt in there? How did Singapore get itself into this situation? Because I thought they were going quite well with handling COVID. Suddenly you've got this fourth wave there. I think it's the fourth wave, and it's the worst so far.
Well, starting mid-August, we started easing restrictions when 80% of the total population was vaccinated. And by allowing the virus to start to do what it does and transmit through the community by easing of the restrictions, we've seen cases come up very quickly because Singapore's a very dense country. So this wave is, if you like, a controlled wave. You have to have it when you basically missed the pandemic through 2020 and 2021. Obviously, when you let it in, then it's going to transmit. But the aim of the vaccine is that it's mostly very mild disease, and that's what it is. 98.7% of our cases are mild or asymptomatic. So,
is this something that could happen elsewhere, like in Australia, say, where vaccination rates are also extremely high, and they're now opening up, eventually opening up to tourists as well at the beginning of next year?
Yeah, I've said publicly that I believe next winter for Australia could be a danger period, just as it's exactly what we're seeing in Europe now. There's as you go into winter and people are closing the windows and doors and huddling inside, then we're seeing transmissions go up. The secret is, will the number of severe cases stay down because of the vaccination? And what we're seeing in Singapore is that even 6% of the unvaccinated eligible is still a sizable number of people that get COVID and put stress on the health system. So all the strategies have to be about protecting the vulnerable, ideally by getting them vaccinated, but otherwise keeping them away from crowds and things like that, and doing everything possible to get them vaccinated and protect them while the surges are going on.
And we've got Christmas coming up, a great time of year when people like to come together, especially families.
Well, if you're in one of the, many countries in Europe have still got 30% of their population unvaccinated. Now, if a lot of those are the vulnerable, particularly the elderly, then absolutely they're going to be in gatherings where someone could have mild or asymptomatic disease. And you could see another surge related to gatherings because you've still got 30% of the population unvaccinated, which is a lot of people. Maybe a small percentage, but a large number numerically.
Dale Fisher there on the situation in Singapore. Thank you very much for being on the show.
My pleasure.
Austria is imposing a new 10-day nationwide lockdown to contain a fourth wave of cases. Chancellor Alexander Schallenberg says it will take effect Monday. Most stores will close and cultural events will be cancelled, while parents are being told to keep their kids at home. The Chancellor also announced vaccination against COVID-19 will become a requirement starting February. Austria has one of the lowest vaccination rates in Europe. Finally managed to get my third shot. Relieved to know I'll be somewhat better protected. Here's more from Derek Williams.
For which groups are healthcare authorities recommending a third dose, and why?
It makes sense here to differentiate between additional doses and booster doses. Additional doses have, for example, been recommended for some time in many places for people who suffer from immune deficiencies, like that caused by HIV, but also deficiencies caused by medications that have to be taken during cancer therapy, for example, or after an organ transplant. Booster shots, on the other hand, are a more recent move. They're given after someone has completed a recommended vaccine series to help top up immune memory. The problem is it hasn't been clear who was supposed to get them or who should get them and when. In the US, recommendations for booster shots, for instance, were something of a mess in the last weeks, with federal recommendations to first give Pfizer-BioNTech boosters to the elderly and high-risk groups, but with many states choosing to authorize them for pretty much everyone. Other countries are moving faster or slower. Israel, for instance, began offering booster shots to everyone over the age of 12 back in August. In Britain, the age for getting one has just been lowered to 40. The EU has approved boosters for all adults 6 months after completing the initial vaccine course, but it's leaving distribution up to individual countries. In France, for instance, authorities have been offering boosters to over 65s since September, while here in Germany, the messaging has also been pretty confusing, but health ministers have agreed that boosters should be offered to everyone who's eligible to be vaccinated in the first place, with the elderly and the high-risk groups prioritized. So really lots of confusion in lots of countries, but I would expect that by the end of the year or so, most of them with sufficient vaccine supplies will recommend boosters across the board to anyone who's 5 or 6 months out from their second shot.